Hello everyone, this is Pathak and you're watching my channel. So today I will talk about the last chapter of NABH Science 5th edition, which is chapter number 10, Information Management Systems. You can also see the Instagram ID on the slide, Healthcare for You Forever. You can follow my account. So let's get started with this particular chapter. Okay, now I'll talk about the intent of the chapter. So the first point here on the slide is the goal of the information management in the organization is to ensure that the right information is available to the right person at the right time. The second point here on the slide is the information management includes management of hospital information system as well as the modalities of information communicated to staff, patient, visitors, and community in general. The third point here on the slide is data and information management must be directed to meet the organization's needs and support the delivery of quality patient care. The information needs are provided in an authenticated, secure, and accurate manner at the right time and place. So now I'll talk about the rest of the points of the intent of the chapter. The first point here on the slide is the confidentiality, integrity, and security of records, data, and information is maintained. Confidentiality of protected health information is paramount and is safeguarded across all information processing, storing, and disseminating platforms. Information management also includes periodic review, revision, and withdrawal of obsolete information to avoid confusion among staff, patient, and visitors. The organization maintains a complete and accurate medical record for every patient. Various aspects of the medical record like contents, staff authorized to make entries and retention records are addressed effectively by the organization. The medical record is available for appropriate care providers. The medical records are reviewed at regular intervals. So this was all about the intent of the chapter. So now we will move on to standards. So now I'll talk about the first standard here on the slide. Information needs of the patient, visitors, staff, management, and external agencies are met. The organization identifies the information needs of the patient, visitors, staff, management, external agencies, and community. Identified information needs are captured or disseminated. Information management technology acquisitions are commensurate with the identified information needs. A maintenance plan for information technology and communication network is implemented. So this is all included in the first standard. The second standard here on the slide is the organization has processes in place for management and control of data and information. So the processes for data collection are standardized. The data is analyzed to meet the information needs. The organization disseminates the information in a timely and accurate manner. The organization stores and retrieves the data according to its information need. So this is all included in the second standard. The third standard here on the slide is the patient cared for by the organization have a complete and accurate medical record. The unique identifier is assigned to the medical record. The contents of the medical record are identified and documented. The medical record provides a complete, up-to-date and chronological account of patient care. The authorized staff make the entry in the medical record. Entry in the medical record is signed, dated, and timed. So this is all included in the third standard. So the fourth standard here on the slide is the medical record reflects the continuity of care. The medical record contains the information regarding the reasons for admission, diagnosis, and care plan. The medical record contains the details of assessment, reassessment, and consultation. The medical record contains the results of investigation and details of the care provided. The medical record contains a copy of the discharge summary. When a patient is transferred to another organization, the medical record contains the details of the transfer. Care providers have access to the current and past medical records. So this is all included in the fourth standard. So let's move on to the next slide to talk about the rest of the standards of this particular chapter. Okay, so now I'll talk about the fifth standard. The organization maintains confidentiality, integrity, and security of records, data, and information. The organization maintains the confidentiality of records, data, and information. The organization maintains the integrity of records, data, and information. Then organization maintains the security of records, data, and information. The organization uses developments in appropriate technology for improving confidentiality, integrity, and security. The request for access to information in the medical records by the patients, physicians, and other physical public agencies are addressed consistently. Okay, the sixth standard here on the slide is the organization ensures the availability of current and relevant documents, records, data, and information and provides retention for the same. The organization has an effective process for document control. The organization retains patients' clinical records, data, and information according to its requirements. Then the retention process provides expected confidentiality and security. The destruction of medical records, data, and information are in accordance with the written guidance. This is all included in the sixth standard. So the seventh standard here on the slide is the organization carries out a review of medical records. The medical records are reviewed periodically. The review uses a representative sample based on statistical principles. The review is conducted by identified individuals. The review of records is based on identified parameters. The review process includes records of both active and discharged patients. The review points out documents any deficiencies in the records. So this is all included in the seventh standard. So I hope you really like this video. Thank you everyone for watching this video. So this was the last chapter of NABH Science 5th edition. Okay, so I will now upload new videos on different healthcare aspects. So stay tuned to my channel. Thank you so much for everything, and bye bye. Stay safe and healthy.